Bismillahirrahmanirrahim. Today we will talk about chest tube insertion. Our video includes two parts: indications of chest tube insertion and technique of chest tube insertion. Regarding the indications, they are pneumothorax, hemothorax, and post-thoracotomy operations. Regarding the technique, first we clean the area of the proposed tube or drain insertion and place a sterile drapes. We then infiltrate the skin and subcutaneous tissue with local anesthetic. Make a 2 to 3 cm incision parallel to the ribs in the appropriate intercostal space. Separate the muscle fibers apart with an artery forceps to expose the pleura. And then we pierce the pleura with the artery forceps and introduce our finger to ensure entry to the pleural space. With the guiding finger still in place, we introduce the chest tube into the pleural space. And then we place 2 loose sutures across the wound to allow easy closure when the tube is removed. We suture the tube in place with a skin suture and tie it multiple times around the tube. Usually use silk suture. We then apply sterile dressing and then attach the tube to the underwater seal, and never forget to get a chest x-ray to confirm the position of the tube. Now we will show a video with chest tube insertion. First, the doctor is infiltrating the skin and subcutaneous tissue with the local anesthetic, as you can see, and there are markers and writing of the local anatomy in order to obtain the right position for the chest tube insertion. Here he is infiltrating the local anesthetic. Then he is making the skin incision now along the mark he has done, and he is deepening the skin incision to the subcutaneous tissue. This is the artery forceps, and here he uses the artery forceps in order to separate the subcutaneous tissue and reach the pleural space. He is using his finger in order to separate the muscle fibers. Now he is using his artery forceps in order to separate the muscle fibers, subcutaneous tissue and skin in order to make space for the insertion of the chest tube. He is using his finger in order to confirm entry to the pleural space, and now he is inserting the chest tube inside the pleural space using the artery forceps. After inserting it, now he is fixing the chest tube using silk sutures. The fixation of the chest tube is very important. After he takes the bites of the suture, he then uses his hand to make multiple ties and knots around the tube. He also can have more than one suture in order to make more secure fixation of the tube. He is now going around the tube multiple times, going back and forth in order to make good fixation with this chest tube. Again going back and forth around the tube and taking so many knots in order to make good fixation of the tube. And now he has finished his chest tube insertion and fixation. Thank you for watching.